What can you expect when you come to my office and ask for full mouth rehabilitation with implants? I want to show you a stepwise process of what your expectation should be when you come in to request a procedure like that. This gentleman, for example, was exactly that. He came in and he told me, I'm not happy with my teeth at all. It's been a while since I've been to a dentist and I want to do something about it. So I took an initial look at him and I said, it doesn't look terribly bad. Maybe we can save these teeth. Maybe, we can do something about those teeth to fix the cavities and get it going with just your natural teeth. And he said, yeah, I've been to a few doctors and they told me it's not going to be possible. So I started taking x-rays. And on the x-rays, we noticed that these cavities have started going deep underneath the gingiva. They've been too extensive. They've been giving him sensitivity all around. And we see a significant gingival loss in the areas, significant bone loss as well. And we decided, yes, it might not be a best idea to try to save these teeth. It might be more destructive actually to the patient to leave these teeth in place and try to patch it up and restore it, considering that he is missing a lot of his back teeth as well. So we ended up starting him on a full mouth rehabilitation utilizing implant-supported prosthesis. So we took our initial records, we devised the plan, we decided let's do 5 implants on the top, 6 implants on the bottom, and get him teeth on the same day. This is what the process involves from our surgical perspective, where we have this set of guides, set of reductions to do, and set of stackable pieces that go in so that we can do the surgery. We can see where he's going to start with and where he's going to end up with after the teeth are removed and after the bone is leveled, since we saw a lot of uneven ridges on the bone. And same thing with the top, where he started with his teeth and where he's going to end up having a leveled bed for the implants to go into. This is what we call a reduction guide. It's being anchored in place using these holes into the side of your bone. This way it can stay stable, and then everything gets attached using these magnets in here on top of it. And this you can see is our also reduction guide. That's where we reduce and level the bone. On top of it, we stack in the guide that goes in next, which is the one for the placement of implant that goes through these holes. And this is how this looks intraorally. The patients are usually asleep for this procedure. We place our guide, we level our bone, either with a piezo or with a burrs, and afterwards we place the implant. So you can see the implant right here, implant right here, implant here, implant here, and implant here. And there is another one right in the back, and that's the 6 implants on the bottom. And this is that whole assembly with one of the implants being placed through the guide, which is why we call this a guided surgery, because it goes exactly as we designed it to go. This patient also received his temporaries on the same day, which we utilize something called micron mapper, which is a photogrammetry device with these little tags that get placed in the back and in the front and in a palette. And this allows us to match all of our scans together digitally so that we can create a restoration for him that's predictable. And these scan bodies, as we call them, is what goes during the surgery on, and we get a big camera scan of you so that we can actually design this temporary. And these are the temporaries. As you can see, temporaries are made to look like teeth. They have pink to them as well because he did have a lot of loss of gum and bone, but we kept it to the minimum. And this is the whole assembly together. So you can see how this assembly looks like together in his mouth. So after the surgery is complete and he has these healing caps on, the temporaries fabricated, and the temporaries are being placed in, both top and the bottom, onto these implants and it's screwed in so it doesn't come off. Then the patient heals, he's able to smile, he's able to chew with these temporaries, come back for the follow-up. So at the follow-up, that's when we see, okay, what are the changes in the tissue, because usually they are, and that's why you're in temporaries for about 6 months. And the changes that we expect is some recession areas, which are normal. These are actually not implants that you see. These are called multi-unit abutments that are visible here. And at the appointment that we change temporaries to the finals, we drop them lower so that they are hidden underneath the tissue. And this is basically how you get your full mouth rehabilitation from start to finish in one day during a surgery. And it might be a long surgery, but that surgery happens when you're asleep, from the time that you show up with the teeth like you wear, all the way to the temporary stage. And then after that, you heal for 6 months and you get your finals.